All right, and welcome again to the SCR Connections webinar. Thank you everyone for joining us. It is our pleasure to introduce our guest speaker for our January webinar, Dr. Emily Spence-Almaguer. Dr. Spence-Almaguer is Associate Dean for Community Engagement and Health Equity, as well as Associate Professor in the Department of Health Behavior and Health Systems in the School of Public Health at the University of North Texas Health Science Center. She also serves as Outreach Corps Director for the Texas Center for Health Disparities, a National Institute of Health Center of Excellence. Her research interests include program evaluation, community assessment, poverty, homelessness, community-based participatory research, and interpersonal violence. She serves as the lead evaluator or investigator for several large community initiatives associated with interpersonal violence, health coaching, poverty, mental health, financial stability, homelessness, and mentoring. Before I hand it over to our speaker, I also want to say we are pleased not only to have her presenting for us, but to also have her physically here in the room with us. It's a first for our SCR office. Welcome, Dr. Spence-Almaguer.
Thank you.
All right, I'm going to pass the mouse over to Dr. Spence-Almaguer.
Great. Good morning. I'm excited to be here today. It's always unusual, though, to give a webinar because you can't tell who your audience is and whether or not they are interested and engaged in what you're doing. So I was thinking next time I do this, I might bring a set of bobbleheads so that people are nodding as I'm talking. So I have been working on needs assessments for about the past 20 years. I have done some broad-based community needs assessment as well as some issue-focused ones on homelessness and violence. A lot has changed since the 90s when I started doing this work, and I'm excited to talk about some of those directions where I think the field is heading. First, I'd like to start, oops, what am I doing here? This one? Mm-hmm. I'd like to start just by thinking about the kind of questions that we have that typically guide needs assessments. I have some questions up here. Are residents aware of the services available through libraries? What kind of classes will help people end their unemployment? What can we do to increase student retention? What I'd like to see right now in the chat window, if some of you could post some of the questions that have driven you to participate in this webinar today, that would be great. I'll pause for a moment while you do that. So some of you are interested in community outreach and figuring out how to best serve your target populations. Anything else? I think it's a good time to reflect on why we initiate a needs assessment to begin with. Oh, now we're getting a whole bunch more things. Are people aware of reliable medical information? How can you present your CNA data in an impactful way? How can we measure the need and effectiveness in your area? Excellent. A lot of times needs are driven by people's anecdotal observations. You may see something happening in your community and wonder to what extent is that a large need. I think this is a good time to reflect on what assumptions are you making. One of my initial experiences in working with homelessness in our community is when I first started talking to community leaders about the problem, many of them were making a lot of assumptions that simply aren't true about people who are homeless, and they were suggesting that they develop funds to give people lifestyle courses. They thought if people took lifestyle classes, that would make them no longer homeless again. And I think if you spent a little bit of time exploring the roots of homelessness, you'd know that poverty is one of the largest roots, and that's not something, unfortunately, we can fix with lifestyle classes. If it is, we would have solved poverty a long time ago. So some other good reasons that I see to do community needs assessments is that most often the grant applications that you write require that you provide some needs assessment data. And sometimes that data is already available to you in your community, and sometimes it is not. And if you have the ability to gather information that strengthens your proposal, it's a great opportunity to do that. Another thing is that this data helps to confirm or refute perceptions that people have. So it gives you the opportunity to respond to people's misperceptions of problems or to kind of elaborate on what those issues of concern are. When we did an assessment of homeless women's experiences with violence, even those of us doing the work were absolutely stunned at the rate of violence against homeless women while they were homeless. We asked people about their experiences during the prior year that they'd been homeless, and we found that more than half of them had been victimized while they were homeless, and that was simply a proportion that we did not anticipate at all, and those findings led to a lot of community changes. So this kind of data helps us to kind of formalize our understanding of what problems are. It promotes community collaboration because if done well, it involves a lot of community stakeholders who are interested in the issues. It helps us guide program design and development and promotes us using data to drive those decisions. And one of the most important things, you know, as an evaluator is that it helps to establish baselines. So we have a good sense of where we are now and what that will mean for us moving forward. So if you noticed, I've talked about conducting an assessment of community needs and assets. There's a lot of great reason to include the word assets when you're talking about needs assessments, because historically, needs assessments have focused on what is wrong with a particular group of people or what are the deficits in your community that needs to be fixed. I want you to imagine for a moment something that you personally struggle with. Maybe it's your nutrition or how you spend money or you go to Starbucks too often, who knows? Just think about something that you're trying to change or you're trying to work on. Many of us in January are doing exactly that. Imagine if somebody observed maybe your grocery cart in the grocery store last week or saw you parenting for 20 minutes out in public, and they drew some conclusions about what you need because of their limited observation of what may or may not be your problem. That's kind of how communities historically were experiencing needs assessment. It was like an outside stranger looking at them, telling them what they need to do in their life when that person really doesn't understand their issues at all. So we like to include asset assessment as part of a needs assessment process because in order to promote community change, you need to be able to fully understand what's good in the community and where the gaps are, what are the struggles. Those are equally important issues. So some general quality indicators that you should look for when you're looking to do a needs assessment or you're reviewing existing needs assessment is number one, assessments should be driven by stakeholders. And stakeholders are anybody in a community or a region who has an interest or will be impacted by the work that you're doing. The next most important thing is that you should see multiple data sources of information that have driven that assessment. Those data sources should have a wide breadth of data as well as a rigor of the data collection process. Third, you should see that the data has been triangulated, that it's not just treated as separate data elements that are siloed by themselves. A good needs assessment is going to compare and contrast different sources of data and use those comparisons to drive further questions and analysis of the data. Another important strength of strong assessments is that they include both qualitative and quantitative sources of data. So I'm sure most of you know what those basic things are, but qualitative data is more textual and organic, and quantitative data is fixed and involves numbers. The great thing about including both of these mixed methods is that the strengths of one offset the weakness of the other. And another final piece is that you should see kind of a multi-phase iteration process of the collection and analysis of data. A good needs assessment involves looking at the data, going back and collecting more information, and looking again and kind of figuring out what do you know and what do you still need to know moving forward about the issue. So we're going to talk about 6 phases today, starting with developing a stakeholder team, then engaging in some preliminary review activities, then planning, then actually collecting and analyzing data, synthesizing it, and moving forward with an action plan. So the first step is forming your team of stakeholders. And while many of us, when we say the word diversity, we may think of ethnic and cultural diversity or age diversity, I really think when you're doing a needs assessment, you should be thinking about diversity of thoughts, diversity of expertise, of course diversity of culture, and diversity of planning and interaction styles and communication styles. The more diversity you have on the team, sometimes that can make for very rich discussions, but it also helps to generate a most holistic and advanced understanding of the issues, as well as a stronger planning process. The other part of this initial team development is engaging in some dialogue where the team as a whole clarifies what is their intent, how do they define the issues, what kind of understanding do they have of the issues. Many years ago when I started working in the area of crime victimization, a lot of dialogue was happening around the issue of people not reporting crimes that they had experienced. And initially some needs assessments were generated that focused on how do we get crime victims to cooperate with the criminal justice system. And at the time, I was a rape crisis counselor, and my experience in working with people who had been sexually assaulted was that the criminal justice process for them was so re-victimizing and so horrific, and very often it put them more at risk for harm later on. Some people continued to be threatened, and many people just continued to have unnecessary health and mental health problems that resulted from their participation in the system. So at the time, I thought a better question was to ask, how can the system change to promote the increased likelihood that people would want to report, not how do you change the victims in order to get them to report more often. So it's those kinds of issues that we need for people to talk through and make sure that you are working under the same assumptions. So the next step is engaging in a preliminary review. This is a good time to look at the literature and think about what do you already know about the issues. What does the literature say? I usually look for other community assessments that have been done around the country. The great thing about the internet is that if you have good enough Googling skills, you can probably find them. Very often there are community assessments that also exist in your own community that may have been done historically. So I get really excited when I can find an old community assessment that allows us to have a baseline So if we continue to collect that data, we can look at changes and trends over time. And at this phase, I think if you did the first phase really well and you have a very diverse group of stakeholders, you should be aware of the majority of resources that are available to you with that group. The next step is to really think critically about your time and your resources and your skill sets. I think a lot of times with needs assessment, people have enough knowledge to be dangerous, meaning that they may have enough information to do some preliminary aspects of data collection, but they may not necessarily have the ability to develop a really strong survey or the data analysis skills to make good use of the data and draw conclusions from it. So it's good to reflect on what do you have right now and what would you need to be able to move forward with the kind of needs assessment that you want to do. Some of the data collection processes are very time-consuming and laborious, and you have to add in extra time for your stakeholder involvement and the process of having groups making decisions. In the first needs assessment that I ever did, I broke down every component of the needs assessment, and I estimated the amount of time that each piece of those components would take, and then I doubled that, and I built our budget around the doubled time estimate. And ultimately, what actually happened is that the full needs assessment took about 1/2 more time in addition to that doubled time that I had initially estimated. So what often seems simple really becomes very complex, and when you start triangulating data sources, it becomes even more complex after that. So another part of step 3 that's real important is developing answerable questions. So in your preliminary review and preliminary process, you probably identified some big guiding questions, but at this point you need to develop more precise and specific questions. And these are the questions that would then generate or be linked to particular sources of data that can answer them. I like to start with imagining what the ideal source of information would be to answer my questions. And I come up with that list first, and then I step back and start looking for what are my realistic options, and what is the best type of data that I can use to answer the questions that I have. Rarely do we have perfect data. We are often working with data that already exists, or we're working with limited resources. So in this process, you're kind of engaging in a balance between what do I want and what can I make use with what I have. Some considerations that you generally want to think about in conducting needs assessments. Often people are looking at existing services and resources. And so some of the questions that we typically ask around those are around the constructs of availability, accessibility, and adequacy. A service might be available, meaning it exists in your community, but it might not be accessible to everyone who needs it. We provide a lot of services to our local homeless and high poverty populations. We may offer services that require them to spend 4 hours riding a bus, getting to and from, just to maybe attend a 1-hour session on something. That means that that service is not really accessible to them if it requires an entire day of their time and may require bus pass resources that they don't have. That other dimension of adequacy is maybe it's available and it is accessible, but it's really not adequate. People may not be happy with it, or their experience might not be very good. When we've tried to help our low-income population get connected to like YMCA memberships and gyms, if people go to swim at the pool and there are no lanes available, they might decide that that isn't very adequate. It's available and accessible, but when they try to get it, it doesn't really meet their needs. So all those dimensions are important questions when you're thinking about developing assessments around resources. The other thing that I typically do in this phase that I find very helpful is to start a spreadsheet, and in one column I put my questions, and in the next column right next to that I put my potential data sources, and in the column after that I write down my type of analysis that I would do with that data. And in the next column, I write down the resources that I would need to be able to collect and analyze that data. And that helps me get a sense of the breadth of what the assessment will ultimately look like. So I'm breaking up data collection options into 3 primary areas, which are a little bit false because I have social indicators separated from quantitative data. But I have a reason for doing that. I think it's important to talk about social indicator data a little bit different. So I'm going to move on to that slide first. Social indicators are publicly available data sets. Sometimes they are available as a data download, but more often they are simply aggregated and available online. I have a couple of links here that you could follow and check out. I'm sure many of you have already been on some of these. But the great thing about social indicator data, I often start with social indicator data before I even fully plan a needs assessment, just so that I can see what is out there. Social indicator data is probably the most kind of quickest changing area of needs assessment. We are in a phase of what people are calling the democratization of data, meaning there's so much data out there and there are now electronic tools to make that data accessible to anyone with a few keystrokes. You'll find data dashboards online where people have already summarized the data. You'll find some interactive dashboards that some of them use a software called Tableau, which we use as well, which allows you to kind of filter and engage the data on your own in an online platform. One of the problems with social indicator data is that the shelf life of these links tends to be very short. Every single time I ever give a presentation on needs assessment, I have to update all of my links because they change on a fairly regular basis. The good news is that the change is in a positive direction. There seems to be more and more data every time I go and look for it. I can find more information out there. So the next thing I'd like to talk about are your qualitative data options. The first is conducting key informant interviews. You generally don't need to do a lot of key informant interviews. They're very time-consuming and they're laborious, but we typically do interviews, one-on-one interviews with key informants because these individuals have a unique perspective that we think is important to include in the assessment. Along those lines, a more cost-effective approach is to do focus groups where you have a group of people who are being interviewed. I recently read a study that compared the cost effectiveness, and they actually found that if you are paying your focus group participants, then it is more cost effective to do key informant interviews because you reach a level of data saturation in a relatively early point. I think it's around 16 people being interviewed. You'll reach data saturation Whereas with focus groups, you'd have to pay, I think you have to do 4 focus groups, but if you're paying each focus group participant, it tends to be more costly. So those are some of the kind of resource issues. Some of the other issues I think you should consider when doing key informant and focus groups are really thinking very carefully about the questions that you will ask. I've found that one of the mistakes that people make when they first start doing these kinds of data collection strategies is that they start with way too many questions, and they have too many quantitative sounding questions. They use close-ended questions, whereas the whole intent of doing interviews with people is to get their more organic, holistic perceptions around what the issues are. So you need to very carefully craft questions that will allow you to do that. I actually have another webinar online through the American Evaluation Association about strategies for asking questions that you could find after this if you're interested. For focus groups, I have heard a lot of people say that they think you should have around 15 people for a focus group. My preference, I've been doing focus groups for a very long time now. My favorite focus group size is between 7 and 10 because I think that allows for more authentic discussion. You tend to lose people when you go beyond that. And you often start getting side conversations between people in the group if you get too large of a group. So that's just my opinion. Others may see it differently. The data analysis for qualitative data is very laborious, particularly if you're going to transcribe all of it. One of the things that we use that kind of helps us minimize our time is we use a software called Audio Note that allows us to take notes and audio record at the same time. And we may not fully transcribe our interviews when we're doing a needs assessment if we're trying to save resources, but we will be able to partially transcribe using Audio Note because you can find the notes that are relevant to the particular question that you're asking and then just play it from there. Another process that I really like to include with focus groups is called a Delphi survey process. If you're actually working with a planning group, very often you'll have individuals in your group who talk more than others or are strong leaders, and they tend to influence the whole group. And if you do short, brief, quantitative surveys in between your group activities, then you tend to get more feedback from those who don't talk as much during the groups, and you can bring the Delphi survey results to the group activities and generate more dialogue around using that method. The other thing that you consider are what we call proxy documents. Those are just existing documents that were collected for another source. These may be meeting minutes. It could really be anything, but oftentimes there's a lot of information out there that could be useful in your assessment. Moving on to quantitative data options. One of the real popular approaches right now is using geographic information system mapping. Some libraries have ArcGIS available to them. I used to work at an institution that had a whole GIS library section, which was fantastic because it's really great data available, and it's a great skill to develop. One of the things I'm really excited about is that through software like Tableau, those of us who haven't gotten as good of training on things like ArcGIS can use Tableau to map as long as the data is organized in a geographic pattern. So if you have addresses or zip codes or counties, Tableau will map that data straight from an Excel spreadsheet. It's a bit more user-friendly process. GIS mapping is really useful. We used it recently to be able to show that the population in our community who had the greatest needs had the least access to resources, because we mapped the resources and we mapped the needs, and they were in total contrast with each other. The other opportunities, kind of going back to the social indicator data, you can download data. There's a lot you can do with it if you have the technical skills to do that. We've also found that many times people will let us purchase data. We purchased all the crime data for our county for one of our last needs assessment, and they charged us a whole $3 for it. It was a really good, useful tool. I could give a whole class on surveys, so I won't do that. I just want to suffice to say that there's a lot of issues that you need to consider when conducting a survey. It's not as easy as just generating questions, throwing them in Qualtrics, and sending out a link. If you're trying to survey the community, it's really important to make sure your questions read at a literacy level of 4th to 6th grade. That may sound low to you, but people do not spend the time that they need to adequately read questions that are being asked of them. So it's really important to go for the lowest literacy level possible with your questions. You also have to think about potential response rates and biases in who is or isn't responding. So I only do surveys if I think I have a target population that will give me a good response rate. And I think that there are things that I can only get through asking a survey. Another important data option is looking at existing records that you already have, maybe at your library or in the community. Existing records can be problematic because they're not very clean usually, and often they're not very consistently collected. So you want to explore those issues before you take the time to start analyzing the data. One of the things that I see happen fairly often is that people draw a wrong conclusion based on their own records review because they don't understand, why there's missing data or what the kind of typical errors are in the data collection process. So the next step is synthesizing and reviewing the data that you have. Hopefully you've gone through an iterative process already where you have collected and analyzed and collected and analyzed. But once you think you've reached a point where you have all the information that you need, the next step is to start putting it all together. And before we take the time to write a needs assessment report, we will spend a lot of time visualizing our data and giving it to stakeholders in its visualized state to get feedback. Data visualization, probably most people are familiar with the data visualization tools in PowerPoint and Microsoft Word, where you can kind of put your data into Excel and graph it out. And those are really useful. That's a very wonderful place to begin. I think it's really important to spend a substantial amount of time exploring the distribution of your data that you have. A lot of people want to jump towards, if they have statistical skills, they want to kind of leap ahead and start conducting statistical tests, and I really caution against doing that because usually there's some problems with your data and you have to understand how it's distributed first so that you don't make poor decisions when looking at bivariate or multivariate relationships in your data. Just for example, you don't want to report the mean of a variable if you have a bimodal distribution, because then you'd have a mean that's somewhere in the center where you have the least amount of data. You would want to report those modes and maybe report the means within the modes. But those are issues that I think are much more clear to people when they see them visualized. It's easier to spot those patterns with a picture than it is with a numeric printout. One of the things that we like to do, I first saw this several years ago at the American Evaluation Association. There was a woman from an evaluation institute in DC who proposed doing evaluation placemats. And ever since that presentation, I have seen the word data placemats crop up over and over again. I wish we could all figure out who originally gave that presentation. It was a quick 5-minute one, so we could give her credit. But this is one of my favorite tools. I take a very large piece of paper, like a legal size paper. I throw a few graphs and other data visualizations on it, and then I leave space for people to write feedback. And if you bring a group of stakeholders together and give them the visualized data, you can generate some really valuable discussions about how to synthesize and understand and then promote decision-making around those data. So then the next step is to move towards action. Thinking about dissemination, typically when we've done a kind of a broad needs assessment, we do a lot of different dissemination activities. We may write a report, but we may also give presentations. We may spend time with groups who, key stakeholder groups who are interested in it. And the important thing is giving different information for different audiences, figuring out what does your audience need to know and what will they not be interested in. And then this is where you begin some solution building. You do not begin it earlier. One of the mistakes that people make with needs assessment is starting with a question that identifies the solution. Like, what's people's needs for this lifestyle education class? Well, if that's not really what they need, the people who are homeless need housing. They need stable housing. So you don't want to begin with the service. You end with thinking about how do the needs drive service planning or program planning, and what are the ideal solutions to do that. And again, this is an important stakeholder-involved process. So I want to shift gears as we end here for just a couple minutes and talk about the needs section of writing a grant proposal, because this is probably something that people are more familiar with, or more people are likely to be charged with writing a statement of need than actually conducting a needs assessment. So some of the typical components of a needs statement include a description of a geographic context and describing community demographics and demographics of your target population, describing your community strengths and assets and resources, and then identifying a 2- or 3-part problem to be solved. This is really the most important part. When you've spent a lot of time reviewing needs and assets in your community, it may be difficult to then narrow it down to a few key issues. But if you do that really well and really concisely in your needs statement, then the rest of your application will logically flow from there. Each element of need that you've identified should logically then link to some part of your proposal, a proposed activity that addresses that particular need. So in this respect, it's really important to develop a logic model and logically link each needs component to a programmatic or activities component, and to kind of spend a good amount of time grouping your needs together in a way that those links are obvious. As I've said before, you want to be careful not to summarize the solution as the need. You don't lead off with, we really need classes for this. You lead off with, what are the issues that have driven your conclusion about the need for classes? The other thing that I always caution people when they're writing a grant application is, no matter what I say about what goes in a needs assessment or doesn't go in it, Ultimately, you want to follow the rules. So you want to follow the guidelines of that particular RFP because the people who are reviewing it will be following those guidelines when they evaluate your proposal. So you don't want to do anything different than what you've been asked to do or suggested to do. So some helpful resources if this has piqued your interest and you want to do some more needs and asset mapping and assessment, there's a couple of authors, James Altschud and Belle Witkin, who have written extensively. They've written articles and books about needs and asset assessment. And then there's a great website, the Asset-Based Community Development Institute focuses on how to promote community change through asset mapping and using assets to conduct community assessments. So I think that brings us to questions.
All right, well, thank you very much for a wonderful presentation. We'd now like to open up for questions. So if anyone has questions, if you would go ahead and put them into the chat box, and we can have a few minutes of question and answer. I'll give everyone a few minutes to type their questions in the box. While we're waiting for some other questions, I might just throw out a question for you. What are some other data visualization tools that you like to use? You mentioned the placemats, but do you have any other ones?
We like to be inspired by good infographics. And this is going to sound terrible, but sometimes I go onto Pinterest and I look for infographics that are really easy to understand and tell a story in a unique way. And I pay attention to how did they organize their data and visualize their data to tell that story. So data visualization is not just about the graph. It's about the icons and the color and the size and the sense of movement and bringing that all together so that you promote understanding of the information. We have a subscription to something called PictoChart, which is kind of an easy infograph maker. But we've also purchased some subscriptions to icons that allow us to customize our graphs and charts with other visual indicators.
All right, well, great, and that transitions really nicely to the question we do have in the chat, deciding what data to highlight on the placement.
That's a great question. So there's a few things that I do when I'm making those decisions. One is I try to think about whether or not I can combine several indicators into a single graph without compromising the understandability of the graph. I want people to look at my graph and within 60 seconds kind of get to know what I'm trying to say. I don't want it to be misleading or confusing. Proper labeling helps with that, you know, labeling your Y and your X axis very clearly. But if you put too many variables or something that's too complex or has too many colors, then people tend to either misinterpret the data or just lose interest in it. So, so I try to choose the most informative graphs. For stakeholders, though, I also try to choose graphs that I feel like I don't have a full understanding of the problem on, and that the stakeholders may give me some insights when they see that data.
All right, great. It looks like we have another comment. If anyone is interested in seeing more infographics, we have that link. Thank you, Steve, for sharing that. We have another question, tips on finding grant sources.
that's a good question. There's a lot of sources out there for people with disabilities. I have found that it's helpful to be on both national and state level listservs for funding announcements. In Texas, there's a State Department of Health and Human Services listserv that provides regular announcements about grant opportunities. I also usually look across the country and see who's doing really cool things and find out how they got money for it. And then look for similar sources of funding in your community. There may be some foundations that are useful. We have a funding information center in our region. I think a lot of regions have similar libraries or services that have information, usually more about foundation funds. Some creative people have been able to get lists of, there's a tax document, I think it's called the 909 maybe, I'm not really sure. But there's a tax listing from foundations where they have to tell people what they've used their foundation funding for. What else? Grants.gov is a national source to begin with.
Well, I'm going to jump in here and say also we have some grants available from the NNLM SCR office, and we'll be releasing our call for applications sometime in the middle of February. So if you want to take a look at some of the funding we have available as well, we'd be really excited to have people from this webinar and from the region in general applying for those funding sources. So those are available on our website as well.
I see there's a question, is there sources we can use for multilingual interviews? In our community, Catholic Charities has translation services, so there may be other similar organizations in your communities that offer translation services. Just stepping back a bit, I just want to make a few comments about translation. When we did a community assessment in a rural county, we translated our survey into Spanish, and I had someone who was Puerto Rican and someone who was Brazilian but learned to speak Spanish work on the forward and back translation of that document. And when I brought that document to someone who is Mexican American, they identified other words that are kind of more typically used among Mexican Americans. So you really have to be cautious about translating to the population that you are actually going to be communicating with.
All right, great. Do we have any final questions for Dr. Spence-Almaguer before we finish up? All right, well, I want to thank you again for coming, Dr. Spence-Almaguer. We really appreciate having you with us. It was a pleasure to have you actually here in the room with us as well. So thank you very much. All right.